Hello everyone. This week I'll be discussing diseases of the genital and urinary tract. I'll be discussing trichomoniasis, chlamydia, and syphilis. Trichomoniasis, sometimes known as trich, is a sexually transmitted disease. Infection with the protozoan parasite Trichomonas vaginalis is the causative agent. Although the illness has a variety of symptoms, most people who are afflicted are unaware they're even infected. Trichomoniasis is also the most prevalent STD that can be cured. According to the CDC, there were more than 2 million trichomoniasis infections in the United States in 2018. Only around 30% of those infected with trichomoniasis exhibit symptoms. Trichomoniasis pathology is produced by damage to the host epithelia caused by a multitude of mechanisms during infection. And new research has emphasized the intricate interactions between the parasite and host, commensal microbiota, and associated symbionts. This parasite can be found in both sperm and vaginal secretions. It commonly spreads between a man and a woman or between two women during unprotected anal, oral, or vaginal intercourse. Furthermore, a male does not need to ejaculate to pass the parasite to his partner. During intercourse, the parasite is passed from an infected person to an uninfected person. The lower vaginal tract is the most often infected region of the body in women. Vulva, vagina, cervix, or urethra are included. For males, the inside of the penis is usually the most affected body area, which is the urethra. The parasite rarely infects other body parts such as hands, mouth, or anus. The symptoms of trichomoniasis can range from moderate discomfort to severe inflammation. Approximately 70% of infected people show no signs or symptoms. Some people develop symptoms 5 to 28 days after becoming infected. Others don't show symptoms for a very long time. Men with trichomoniasis may have the following symptoms: itching or irritation inside the penis, burning after urination or ejaculation, or discharge from the penis. On the other hand, women that suffer from trichomoniasis may have the following symptoms, which include itching, burning, redness or soreness of the genitals, discomfort with urination, or a change in their vaginal discharge that can be clear, white, yellowish, or greenish with an unusual fishy smell. Trichomoniasis cannot be diagnosed only based on symptoms. Your doctor should examine you and order a laboratory test to diagnose trichomoniasis in both men and women. Trichomoniasis is diagnosed using a microscope to examine a sample of vaginal fluid in women or urine in males. No additional tests are required if the parasite can be observed under a microscope. Rapid antigen testing and nucleic acid amplification may be utilized if this test isn't conclusive. The prevalence of Trichomonas vaginalis in the United States is 2.1% among women ages 14 to 59 and 0.5% among men, based on a nationally representative sample of people who participated in NHANES 2013 to 2016. Trichomoniasis is the most prevalent treatable STD in the United States, affecting both men and women. The condition affects around 3.7 million people in the United States. Prevalence was 9.6% for African American women, 1.4% for Hispanic women, and 0.8% for non-Hispanic white women. For men and women, increasing poverty level, lowering educational level, unmarried status, and having been born in the U.S. are associated with T. vaginalis infection. For women younger at age that they first have sex, greater number of sex partners, and a history of chlamydia infection in the past 12 months are associated with T. vaginalis infection as well. If you become infected with trichomoniasis, there is hope for treatment. Even for pregnant women, the most usual therapy for trichomoniasis is to take 1 megadose of metronidazole or tinidazole. Your doctor may prescribe a lesser dose of metronidazole twice a day for 7 days in some circumstances. Both you and your partner require medical attention. You must also refrain from sexual activity until the infection has healed, which takes about a week. Alcohol should not be consumed for 24 or 72 hours after taking metronidazole or tinidazole, since it may induce severe nausea and vomiting. From 2 weeks to 3 months following treatment, your doctor will likely want to retest you for trichomoniasis to ensure you haven't been reinfected. The next sexually transmitted disease I'll be discussing is chlamydia. The causative agent of chlamydia is Chlamydia trachomatis infection. In women, it can cause cervicitis, and in both men and women, it can induce urethritis and proctitis. Infections with chlamydia can cause major problems in women, including pelvic inflammatory disease, tubal factor infertility, ectopic pregnancy, and persistent pelvic discomfort. If you take a closer look at chlamydia disease mechanisms, you'll see that the chlamydia bacterium invades and infects the host cells, which they rely on for nutrition. If the bacteria infecting human cells are deprived of these nutrients, the bacteria will die as well. When chlamydia bacteria are deficient in nutrients like vitamins or iron, they stop dividing and develop to an excessively big size. These abnormal cells, on the other hand, can stay alive because they can revert to a normal state and be ready to divide once the host cell circumstances return to normal. Infected people transfer the illness to their sexual partners through unprotected vaginal, oral, or anal sexual contact. Sharing sex devices that haven't been washed or aren't covered with a fresh condom can potentially spread the virus. Penetrative sexual intercourse is not always required for infection to occur. Simply coming in contact with sexual bodily secretions from an infected individual is enough to cause infection. Another way for the virus to spread is by vertical transmission, which occurs when a baby passes through the vaginal canal of an infected mother during childbirth. Because most infected individuals are asymptomatic and have no abnormal physical examination results, chlamydia is often characterized as a silent illness. The bacteria infect the cervix in women, causing signs and symptoms of cervicitis, and occasionally the urethra, causing signs and symptoms of urethritis. Infection can spread from the cervix to the upper reproductive tract, resulting in pelvic inflammatory disease, which can be asymptomatic or acute, with symptoms such as abdominal or pelvic pain, cervical motion tenderness, and uterine or adnexal tenderness on examination. Symptomatic men often experience urethritis, which manifests as a mucoid or watery urethral discharge and dysuria. Epididymitis, with or without symptomatic urethritis, affects a small percentage of infected men, causing unilateral testicular discomfort, tenderness, and swelling. Chlamydia can be diagnosed using a variety of techniques, including nucleic acid amplification test, cell culture, and others. Nucleic acid amplification tests are the most sensitive tests, and they may be conducted on easily accessible materials such as vaginal swabs, either obtained by the doctor or by the patient, or urine. In women, vaginal swabs, either taken by the patient or the physician, are the best specimen to screen for genital chlamydia. Using nucleic acid amplification test In males, urine is the preferred specimen, and it is an effective alternative specimen for women. Self-collected vaginal swab specimens perform similarly to other nucleic acid amplification tests. Approved specimens. According to the 2018 Global STI Surveillance from World Health Organization, also known as WHO, the global estimation of new chlamydia trachomatis cases in 2016 was 127 million. Chlamydia infections are asymptomatic in 61% of women and 68% of men, and as a result often go undiagnosed, untreated, causing onward transmission. Highly prevalent STD among teenagers, chlamydia is expected to affect 1 out of every 20 sexually active young women aged 14 to 24. For a variety of behavioral, biological, and cultural factors, sexually active young people are at a high risk of contracting chlamydia. Some young individuals do not use condoms on a regular basis. Also, some teenagers may transition from one monogamous relationship to the next faster than chlamydia's anticipated infectivity phase, increasing the risk of transmission. Antibiotics are the simple way to treat chlamydia. More than 95% of people will be cured if they take their antibiotics correctly. To prevent transmitting the infection to partners, people with chlamydia should refrain from sexual activity for 7 days after receiving a single dosage of antibiotics, or until the end of a 7-day course of antibiotics. It is critical to take all the chlamydia treatment as directed by your physician. The 2 most often prescribed antibiotics for treatment of chlamydia is doxycycline and azithromycin. The final disease I'll be discussing is syphilis. Syphilis is caused by the bacteria Treponema pallidum, also known as T. pallidum. There are several phases of syphilis: primary, secondary, latent, and tertiary. Each stage is marked by its own set of indications and symptoms. Syphilis disease mechanisms include spirochetes entering the systemic circulation through mucosal membranes or tiny skin abrasions, which invade the central nervous system in the early stages of illness. Endarteritis and plasma cell-rich infiltrates are histological characteristic findings, indicating a delayed type hypersensitivity reaction to the spirochete. Syphilis causes vasculitis by attaching fibronectin molecules to the endothelial surface of the vessels in the organs, producing inflammation and obliteration of the tiny blood vessels. You may detect a single or numerous lesions during the first primary stage of syphilis. The sore marks the entry point for syphilis into your body. Firm, circular, and painless sores are common, though not always. Whether you receive therapy, the sores normally last 3 to 6 weeks, then heals. You must continue to receive therapy even after the sore has healed. This will prevent your infection from progressing to the next stage. You may develop skin rashes and or mucous membrane lesions during the secondary stage. Mouth, vaginal, or anus sores are mucous membrane lesions. A rash on one or more parts of your body generally marks the beginning of this stage. The rash might appear while your initial sore is healing or after it has healed for several weeks. The rash might resemble a rough, itchy rash. A period of time when there are no obvious indications of symptoms of syphilis is known as the latent stage. You can have syphilis in your body for years without showing any symptoms or signs if you don't get treated. The majority of people who have untreated syphilis do not progress to tertiary syphilis. When it does happen, though, it can impact a variety of organ systems. The heart and blood vessels, as well as the brain and nervous system, are among the organs that are affected. Tertiary syphilis is an extremely dangerous illness that develops 10 to 30 years after the first infection. The illness destroys your internal organs and might even lead to death. Antibodies specific for syphilis can be detected using treponema tests, such as TPPA, different EIAs, and further on. Treponema antibodies emerge sooner than non-treponema antibodies and are generally detectable for the rest of one's life, even if treatment is effective. If the findings of a treponema test are positive, a non-treponema test with titers should be done to confirm the diagnosis and guide patient care options. Many nations with endemic syphilis saw a drop in syphilis prevalence in the late 1990s due to the advent of syndromic care for STIs, behavioral changes, and the effect of AIDS mortality breaking sexual networks. However, following the advent of antiretroviral medication, syphilis rates have risen, particularly among men who have sex with other men, possibly as a result of the rebuilding of sexual networks and increasing sexual contact frequency. 129,813 cases of all stages of syphilis were reported in 2019, including 38,992 cases of primary and secondary syphilis, the most infectious stages of the disease. After reaching a historic low in 2000 and 2001, the rate of P and S syphilis has increased almost every year, increasing 11.2% in 2018 to 2019. Rates rose among men and women in every region of the country and across all racial and ethnic groups. Treatment for syphilis includes benzathine penicillin G, 2.4 million units taken intramuscularly in a single dose is recommended therapy for adults and adolescents with primary, secondary, or early latent syphilis. Benzathine penicillin G, 7.2 million units total, taken in 3 doses of 2.4 million units intramuscularly at weekly intervals, is recommended therapy for adults and adolescents with latent syphilis or latent syphilis of unclear duration. Aqueous crystalline penicillin G, 18 to 24 million units a day, provided as a 3 to 4 million units intravenously every 4 hours or as continuous infusion for 10 to 14 days, is the recommended treatment for neurosyphilis, ocular syphilis, or otosyphilis. This is the end of my presentation, and I want to thank everyone for listening. Have a great week.